Dear all, health workers are rapidly replacing soldiers as our war heroes. This is why every evening at 8, we open our windows or we stand on our balconies to participate in this new global ritual, a virtual street parade to applaud all victorious medical soldiers. But last week, Dr. Joshua Weiner, a transplant surgeon from New York, wrote a truly startling article for the New York Times. Let's listen to his story for a moment. As a devoted non-member of Facebook, Twitter and Instagram, an objector to any internet meme or trend, I learned that hashtag Solidarity at 8 is a moment of public silence, cheering or clapping at 8 p.m. each night to show support for healthcare workers. It's a time when the world, or at least the Twitterverse, honors my colleagues and me with a communal offering of thanks. No need. Those who are about to run into the pandemic without adequate gowns, masks, or hand sanitizer do not benefit from a confusing mixture of appreciative noise and not noise any more than would firefighters about to rush into a fire without gear. Like many internet movements, the idea is misguided. It's a salve only to those who are already hiding in the dens stocked up for winter. A perfect activity for the internet age. It's a low investment, risk-free way to wear the mantle of the moment without owning it. It's a noise without action, pontificating about politics without running for office or voting. Doctors don't need any shouting from the windows. We need what's behind your windows, in your living room, hoarded for an apocalypse that will occur only if we do not have the resources needed to fight this pandemic. If you are isolating yourself, then you do not need an arsenal of defenses. Basic social distancing and hand hygiene are sufficient. Those who don't have the luxury of isolating, the people you will rely on if you get sick, require that arsenal. You can't possibly go through this big bottle of hand sanitizer, but you keep it anyway. Please put it back to better use. I have not seen a single bottle at my hospital, and some scavengers have been observed coming to the hospital to fill the home bottles from our supplies. Bring us your extra masks. The critical shortage requires us to use a single mask for multiple patients until it's contaminated or damaged. You don't need 5 of them to go for a walk. Many of our own stockpiles have grown legs and walked away. I propose setting up a service where people who want to show their appreciation for healthcare workers can safely provide the medical materials from their own homes. You can view it as helping to put the resources where they are needed to prevent the pandemic from spreading, or to treat you if you get sick. Please do this instead of yelling out of your window tonight. Give it a hashtag if you would like to. Doctors will take care of coronavirus patients no matter what happens. Most of us are not resentful of their burden, but instead excited to be useful. As the chair of my hospital surgery department wrote so eloquently in one of his daily missives, remember that our families, friends and neighbors are scared, idle, out of work and feel impotent. Anyone working in healthcare still enjoys the rapture of action. It's a privilege. We are happy warriors even if we become victims to the cause. We do not need to be saluted. We will fight for you because it's in our blood and it's what we train to do. But would you please pass the soap? Everything said. Jacob Wallenberg, the Swedish industrialist, has recently warned governments to weight the economic threat from coronavirus much more heavily. In some of his own words, if this crisis goes on for long, unemployment could hit 20-30%. There will be no recovery. There will be social unrest. There will be violence. Citizens will suffer. Some will die, others will feel awful. We have to weigh the risk of a medicine affecting the patients drastically. How does tomorrow look like? The debate has been very much business versus life. but I want to take a life versus life perspective. Authorities are all working very hard to help society, but they are not looking around the corner as much. They are not taking the long-term perspective. So here's my alternative proposal to the street parades applauding health workers. A virtual street protest to force authorities to focus on both current and future risks we now face in our daily life. Open your window or stand on your balcony and just shout out, I'm short on money. I have no job. My business is dying. I'm scared of the future. I need urgent help. What you offer is not enough. And give it a hashtag if you want. I also have another idea for those who can't afford to stay behind the curtains. Start investing again to finance urgent life-saving projects and to support the rebuilding of our economies. Unlike the medical personnel, you take no personal risks.